my name is Melissa. I'm going to be the nurse today. As soon as I come in, I'm going to go see who my patient's going to be for the day. I go to the MAR, and I look and I see that it's Millie Larson. I'm going to look at her date of birth. Her date of birth is 1/1/36, and she has no known allergies. I'm going to see if there's any meds to give for the day. Today, she's going to be given furosemide 20 milligrams IV push, administered over 2 minutes, flushed with 3 mLs of normal saline before and after dose. And this is for edema and her blood pressure. The other medication I'm going to give today is insulin, 10 units, subcutaneous, with breakfast, for control of blood sugar. I'm going to go to the med cart. I'm going to take out my meds. Okay. Half furosemide. I'm going to compare this to the MAR. Do my 5 rates. Alright. Which is the right patient, the right med, the right route, the right dose, and the right time. Furosemide. Right patient, right route, right dose, right time. Okay. I'm going to drop this medication. So I'm going to do the med math. 20 milligrams to be given, and there's 10 milligrams in an ml. So I will be given I will be giving 2 mLs. Okay. Gonna get my alcohol prep. Okay, clean the top. Put air in. Take 2 mLs of air out, of the fluid out. Make sure I document it correctly. I'm going to label the medication. Alright, Lasix, 20 milligrams. Okay, I'm going to compare this to the MAR again. Lasix, 20 milligrams, right patient, right route, right dose, right time. My next medication will be insulin. Okay, right the medication, right patient, right route, right dose, right time. Gonna give this an insulin syringe. Insulin syringe is much smaller than the needle's gonna be much smaller because it's only going into the subcutaneous space. 100 units per ml, and we want to give 10 units subcutaneously. So I will be given 0.1 ml. Okay. And we have a very small amount. I'm going to label it. Insulin 10 units. Right patient, right medication, right route, right dose, right time. I'm going to do that again. Okay, right medication. I've also performed hand hygiene before I touch the medication and after. Okay, I'm going to take all the medication, get everything I need. And go see Millie. Okay, I'm going to take the Mar with me as well. Okay, I have Millie's arm. I'm going to walk in and introduce myself to Millie. Hi, my name is Melissa. I'm going to be your nurse for the day. How are you feeling? Okay. Can you state your name? She's going to tell me her name is Millie Larson. Her date of birth is 1/1/36. She tells me it's 1/1/36. Okay, I tell her that I'm here to give medications to her today. I'm going to give her furosemide. I'm going to tell her this is to get the fluid off of her for her edema and blood pressure. Ask her if she has any allergies. Also, I did check the expiration date on all the medications, and they were all good. So nothing is expired. The first medication I'm going to give is furosemide. Again, I'm going to do the 5 rights. I have the Mar in front of me. Right patient, right medication, right route, right dose, and right time. If I need to, I'll probably get a set of vitals before I give the medication. Because if her blood pressure is too low, I'd probably question giving the Lasix and talk to the doctor. This is her arm. This is the lock. I'm cleaning it. Everything is sterile. Lasix. Before I do that, I want to make sure everything is cleaned. If there's any clots at the end of the lock, I want to flush them out. Make sure it's because I want it to get into her vein. Okay, it's flowing easily, no infiltration. I'm going to clean it again with the alcohol prep. Lasix. And this medication I'm going to give over 2 minutes. Okay, but to speed up this video, I'm going to do it a little faster. Okay, I'm going to do it over 2 minutes, and I'm going to check for any adverse reactions. Okay, I'm going to put this in the syringe container. And I note it on my arm that it was given. IV. Okay, next medication I'm going to give is insulin. I'm going to instruct her that, explain to her that this is for her high blood sugar. Here. But since she's a diabetic, she needs to receive insulin. This is actually subcutaneous. And I'm going to use the orange. Okay. I'm going to do the 5 rights. Right patient, right medication, right route, right dose, right time. I'm gonna do this in her abdomen. This is a very small needle. I'm gonna pinch. I'm gonna clean it. Clean the site. Gonna go in at a 45-90 degree angle. With my non-dominant hand, I'm gonna pinch it. Inject. Put it in the sharps container. Lock the site. Gotta check for any adverse reactions and document that I gave it. Okay, and then before I leave, I'm gonna ask if Millie needs anything. I'm gonna put her in a comfortable position with her head elevated. I'm gonna give her the remote, the call light. If she needs me, she can contact me. I'm gonna document it and bring all the supplies out.